A very good morning to everyone and all. So I'm Dr. Pawan Doble. I'm a consultant gastroenterologist at PD Hinduja Hospital, Mumbai. So today we are going to discuss about liver health. What things you need to know about your liver health, what things you need to do, what practices you need to avoid. You can free to raise your hand and ask me question at any moment during the talk. Mostly I'll be sharing everything about liver. So maybe if you can wait for the talk to get finished and then you can answer. Okay. So liver health, what is healthy liver? So first of all, I would like to show you what is healthy liver looks like. So healthy liver is a very smooth in architecture, normally around 10 to 12 centimeter in size, and it is situated in our right side of the upper quadrant of your abdomen. A diseased liver is increased in size and it is rough in architecture. It has a lot of fat content and it is hard, not a smooth liver. So let's talk about one by one about conditions. Like first, I'd like to introduce you to hepatitis. So hepatitis is generally a very wide term. It includes viral hepatitis. It includes alcohol-induced hepatitis, autoimmune hepatitis. There are some drugs or medicines which can cause hepatitis. And at the last, it is fatty liver, which can also cause hepatitis. So coming to viral hepatitis, they are five viruses, A, B, C, D, E. Most of them, like A and E, are waterborne. They are transmitted through fecal route, and B, C, and D are blood-borne viruses. So they are transmitted through blood. We'll see one by one what is the role in their liver illnesses. So viral hepatitis, like I said, it could be acute. Acute viral hepatitis is a very short duration, lasts for around less than 6 months. Chronic hepatitis is which lasts more than 6 months. So viral hepatitis like A and E generally causes acute hepatitis. The symptoms are typically nausea, vomiting, right upper quadrant pain, and patient will have jaundice like this. So these are called by fecal-oral transmission. Unhygienic routes like bad water and foods from outside not cooked very well, and these are generally self-limiting in 80 to 90% of the patients. Only 10 to 20% require admissions. So how even if we what precautions we can take, we can see the water supply in like Mumbai's and most of the suburbs are through drainage lines, like water pipelines, those who are running very close to drainage lines, and this is how we get our viral infection like A and E. So what could be the best precaution to avoid mostly during monsoons? We should boil our water and drink it. Boiling for at least 1 minute is sufficient to kill the virus. So boiling is recommended during monsoons. Even if you do it or perennial, it is okay. But because of this, you need this. Okay. Reverse osmosis is like RO systems, which are in most of the houses are not efficient to kill hepatitis A and E virus. Coming to blood-borne viruses, which are B and C, they are transmitted through direct blood contact, sharing of needles, unsterile healthcare practices like doing unprotected sex, tattooing, piercing, and it could be mother-to-child transmission also. So newer methods which I have come across recently, like people are coming with hepatitis B and C infections like during dialysis units, which are having not sterile sets. These are some newer fashion like tattooing. They are using same needle in multiple patients and multiple subjects. So hair transplants are the newer modalities to transmit hepatitis B and C virus because it involves piercing of needle into your scalp. It involves little bit of blooding. A very rare scenario wherein I came with recently a patient who underwent this kind of therapy, which is called as cupping therapy, is also a potential risk for transmitting hepatitis B and C virus. So be aware of these practices. Go to early certified centers if you are going through all these kind of therapies, but be very sure that they are using sterile or else a new disposable equipments. So how can we prevent hepatitis B, C viruses? Keep your vaccination. This is hepatitis B vaccine. We don't have any vaccine for hepatitis C. But as of now, we have a very good treatment available for hepatitis C. It's a single pill. But for hepatitis B, you can get vaccinated. It's a 3-dose vaccination schedule completed over 6 months. Please contact your doctor and get yourself vaccinated for hepatitis B vaccine. So another potential cause of hepatitis is over-the-counter herbal preparations like giloy. We have come across many patients who have taken giloy juice for immunity booster and they have suffered from liver injury. So multivitamin products, which are like these products are, the problem with these products are they are not FDA regulated. So their content and everything is not up to the mark, and that's why they causes a lot of hepatitis and immunity problems. So coming to next section is alcohol. Alcohol liver induced. Any amount of alcohol beverage can cause potentially liver damage. People ask that the quantity of drinking which is safe. There is as such no safe limit for alcohol. Many patients does not consider beer as an alcoholic beverage, but beer too can cause alcoholic damage, alcoholic liver injury, as is in same potential like with other drinks. Okay, any amount of alcohol can cause cirrhosis. So what is the spectrum of alcoholic liver? People do come across to OPDs and physicians that my friend is consuming alcohol, so he's so many years, he's not having alcoholic liver disease. How come I have it? So it's a spectrum of alcoholic liver disease. So this is normal smooth liver. You can be in any spectrum of this liver disease during your presentation. So people have generally, they are asymptomatic during initial phases. Like this is steatosis, is fatty liver due to alcohol. Then there is a hepatitis phase, and then there is a end stage cirrhosis. So people do get symptoms of at very end stage cirrhosis, but they could land up in OPDs with all these kind of phases, but they are asymptomatic initially. So how does this is what I told you, this is a normal liver, smooth liver, and this is a cirrhotic liver, hard liver, which causes symptoms. So another variety of alcoholic the hepatitis is autoimmune hepatitis. So these are the normal immune cells which are checking us, protecting us from virus and bacteria, and these are called as macrophages, neutrophils, and all. If there is some problem in immune surveillance, somehow some problem in body, they attack your own liver. In that case, you have a very rare situation. This is called as autoimmune hepatitis. So what are the symptoms of cirrhosis? Cirrhosis generally presents with initially with jaundice, yellow eyes, but as the progressive damage continues, there could be ascites, fluid retention in your abdomen. There could be swelling of your feet. There is loss of appetite. There is muscle wasting. There are reddish dots on your body. And in end stages, there could be mental confusion and memory loss too. So this was alcoholic cirrhosis of liver and other kind of hepatitis. I will like to elaborate more on the current problem of India, and it's huge problem. We are the number one of this problem, which is non-alcoholic fatty liver disease, which is the most common cause of chronic liver disease in the world, and around 30 to 40% of patients in India are suffering from this disorder. So what causes fatty liver? It's obesity, high BMI. Always get your BMI check. It's a simple formula available online, which requires your weight and height. So any BMI more than 25 is an potential. In India, in fact, about 23.5 is an potential to cause fatty liver. So body, it's the same for males and females. Any BMI more than 25 is more risk factor for fatty liver hepatitis, and cirrhosis. So where do you measure your waist circumference for BMI? It's at the level of umbilicus. You can see this kind of belly is an potential risk for fatty liver. So that's what was shown by me in earlier slide, waist hip ratio. Waist hip ratio is your circumference of your body at the level of your umbilicus, waist, and at the level of hip. So if this waist hip ratio is very high, there is a chances of not only fatty liver, but hypertension, type 2 diabetes, and high cholesterol. So what are the causes of obesity? We all know overeating is the most common cause of obesity. There is certain genetic interplay, but sedentary lifestyle, insufficient sleep, stress, and less exercise, no exercise, and certain medication can cause obesity. So this is an emerging health problem in India and is the most common problem. Like I told, 40% of our population is obese, maybe more than that. And it is going to be double in next 10 years, the kind of surge we are seeing. So not only, like I mentioned, it does not only cause liver health, but it also causes high blood pressure, brain stroke, cancers, high cholesterol, osteoarthritis, insulin resistance, gallstones, and even heart attacks. But that is not a topic of today. So we'll focus on liver disease. So everyone should have their neck examined. If your neck is showing this pattern, this is called as acanthosis nigricans. This is hyperkeratosis and folding of your neck folds. So examine your back of neck. If you are having this, there is a chance of diabetes, insulin resistance, and fatty liver in you. So this problem is not only limited to nowadays to adults. It is like children who are also having obesity because of faulty dietary practice, junk food, and of course digital gadgets. They are making them less prone to go outside and exercise and have fatty liver. So you should encourage this kind of exercises, play, and to prevent the future adult obesity and fatty liver. So what can we do for this fatty liver and obesity? So what it causes is sedentary lifestyle, high calorie, refined sugars, fat intake, obesity, and insulin resistance causes high load of glucose on your liver, which gets deposited as a fat in your liver, and eventually once this fat starts depositing, it gets converted into ultimately alcohol and causes hepatitis. So these are there are certain reversible and irreversible stages of this fatty liver. So on mere deposition of fat doesn't cause any harm if detected early. If it progresses to cirrhosis and decompensation, it is irreversible. So like I said, it is 20 to 50, 40% of fatty liver patients will have hepatitis phase. This at this stage, it can be reversed. But if the damage continues, the permanent scarring will occur, and permanent scarring will lead to cirrhosis, and then it is irreversible stage. So these are the stages. This can be detected by simple ultrasound, liver function test, and fibroscan. So all these tests are available with us. Do contact your doctor to get your liver health, liver function test, ultrasound abdomen, if you are obese, if you are diabetic, at what stage you are there. So in India, we have a double trouble: obesity, alcohol together. So this causes a more, yeah, alcohol and obesity. This is a double trouble. So those patients who are more obese, if they also have drinks in their diet lifestyle, the damage will be double. So that's why there is no time duration. Like you don't have defined time duration that at what moment you will have cirrhosis. Certain people who has more of muscle mass, less of fat, will have cirrhosis if they continue to drink at the end of 10, 20 years. But those who are fat, obese, they can present less than 10 years, maybe 5 years. Depends on the quantity of drink, amount of fat, and how much is the muscle mass in them. So anyone with extra weight, especially central obesity around the belly, should control their weight, avoid alcohol, and lose around 10% of their body weight to maintain their liver health well. So what can we do? How can we prevent obesity? It's adopt new healthy habit, balance your calorie intake, and control your weight gain. So what healthy habits you can acquire? Maybe you can use cycle to travel to your work, avoid car or this thing. Have a balanced diet. I'll speak about diet, what kind of diet you need to exercise, like swimming, cycling, playing is more helpful. So always have a calorie count. What should be, everything goes through into your mouth. Calorie in should be calculated daily. Normally, a sedentary person having a desk job does not require more than maybe 1500 to 2000 calories in a day. So you should have a calorie counter apps installed in your mobile phones. They are easily available. You can just count in your calories which are going in and what kind of activities you are doing and calories out. Any extra calories can cause deposition of fat in body. They are deposited and stored as fat and then eventually leads to obesity. So this is the food pyramid I like the most. What should be your for diet? You can see this pyramid, the quantity of diet which should be in more in portion is at base and which should be minimized should be at top. So cereals, millets should be high in content, fruits, vegetables should be moderate, pulses, dairy should be also moderate, but least should be your fat and sugar. Less carb and less sugar is the key to the balanced diet. So uh, even tea, coffee, dairy should be limited. They are high in sugar if you are taking sugar with sugar. This thing encourage brown products like brown whole grains, jowar, bajra, ragi. This thing your fish, poultry, bean should be ample, but red meat like goat meat and cheese should be avoided. Avoid processed food, processed meat, and avoid processed drinks, cold drinks, any kind of processed juice should be is very high in refined sugar should be avoided. So exercise, what are the WHO exercise guidelines? So any exercise which is around 150 minutes of in a week, like moderate exercise should be enough. Like what are the low intensity exercise? Low intensity exercise are walking and gardening. They don't help you much. It should be moderate intensity and high intensity exercises. It should raise your heart rate. So moderate intensity exercises are swimming, slow jogging, yoga. High intensity exercises are like playing tennis, cycling, running, going to the gym. So 75 minutes of high intensity exercises or 150 minutes of moderate exercises weekly to stay fit. You can give a two days off in a week, but you should complete around 150 minutes of moderate intensity exercises. Here, I would like to tell consistency is the key rather than intensity. So moderate intensity, but good consistency exercises keep you fit. So control your excess weight gain during your any kind of vacation, functions, and weddings. Like binge eating causes your weight gain very rapidly, whatever effort you have taken in the past. So what are the tips to, this is the summary slide. Avoid excessive or avoid alcohol consumption, maintain your weight, complete your hepatitis B vaccination schedule, follow the dosages recommended if you are taking any herbal product or any immune boosting product by a doctor. It should not be over the counter advice should be not be taken, and engage in regular physical activity. If you have any question, you can just tell me. This is my summary slide. Thank you.